Hi, I'm Lindsay. I want to talk to you about hepatitis C, or Hep C as I'm going to call it. Today we're going to see just how it can affect you both in custody and at home. We want to raise awareness of Hep C throughout the whole prison. We're going to talk about how it can be passed on and how we can recognise risky behaviour both in here and at home. We want to rid the prison of stigma around Hep C and encourage people to get themselves tested. We also want to improve acceptance of people who are Hep C positive so that you might be able to support someone who is infected and help them through the treatment. So what exactly is hepatitis C? Hep C is a blood-borne virus, which means the main way of catching it is blood on blood. There's a really small chance you can catch it sexually, but I'll come on to that later. It only takes the tiniest amount of blood to transmit the disease, and when I say tiny, I mean microscopic, so small that you can't even see it. Hep C is a virus that attacks the liver and it can lead to cirrhosis. If it's left untreated, it can lead to liver cancer. So let's talk a little bit about your liver. The liver has over 500 different functions. It's very important that it stays intact and healthy. Rather than describe all the functions, it's easier to think of it as the body's washing machine. One of its functions is to break down fats and toxins. Alcohol is a toxin. Therefore, if you stop using drugs and replace this with alcohol, as many people tend to do, you're actually doing yourself more harm. Now, let's pause for a moment to have a little think about the liver and why it's so important. Let me explain just how the virus gets to work once it's inside the body. The arrow illustrates the virus entering the body by, let's say, a needle. The Hep C virus is now in the body. Your body then will produce antibodies, or fighter cells, to try and rid the body of the virus. These fighter cells are really clever. In 20 to 25% of cases, they're tough enough to win the battle and rid the body of active virus. However, in most cases, they need a bit of help with treatment. There are 6 different types of Hep C, 1, 2, 3, 4, 5, 6. In the UK, we mainly see 1, 2 and 3. 4, 5 and 6 are mainly in other countries like Egypt, China and Africa. But with world travel, we are seeing more and more of them in the UK. So, what are the symptoms of Hep C? Unfortunately, they aren't always that simple to spot. They're all things you think could be related to other illnesses, or getting older, or drug withdrawal. Sometimes they're flu-like, such as feeling tired, sweating, and aches and pains, especially in your joints. The damage can occur silently and take years to develop. This is why it's called the silent killer. So, how widespread is the problem? These figures are a few years old, but it illustrates the scale of the problem. There are an estimated 170 million people infected worldwide. Nearly 500,000 of them are in the UK. Of those, just 70,000 have been diagnosed. And of those, only 20,000 have been seen by a specialist every year. And just 5,221 get treated. The difference is huge, don't you think? Now, let's pause for a moment and have a think of why this might be. So, how can Hep C be caught? Well, firstly, by any blood-on-blood encounter. For example, if you're an intravenous drug user, it's not just the needles you share that put you at risk, it's also the spoons, water, filters and tourniquet. Basically, everything you use when doing drugs. Crack pipes are a big risk. Think about it. Your lips become dry and cracked, therefore open wound for blood on blood. Tattoos. Now, this is a major problem. This actually made me get tested because it's not just about the needles, it's about the ink. I have tattoos and I didn't think when I was having them done. I'm negative, but I'm really, really lucky. The way I think of it is, if there's a massive pot being used by the tattooist, it's been shared. If it's a tiny pot, it's usually a new individual one. But never ever get a prison tattoo or piercing because they're never safe. Other countries' hygiene is not always as tight as ours. People go abroad and get dental work done. Who's to say it's safe? What about the ways it can't be caught? Now, this is where stigma comes into the issue. You can't catch it from sweat, showers, skin-to-skin contact, or toilets. The only way you can possibly catch it from a toilet is if there was blood on the seat. But you're not going to sit on it, are you? Remember, always wash your hands and clean your space. Now, we're going to pause for a moment while you all have a think about some other ways of catching Hep C. What do you think? Let's look at some other ways that the risk can be spread and see how many you came up with. There's injecting drugs, piercing, sharing toothbrushes, razors and clippers. As a general rule, remember, if it cuts, it can infect. Blood transfusions carried out before 1991. There is a risk from sexual activity, although it's usually low, but it can get higher with rough or prolonged sex. It can also get transferred from mother to baby. Fights and contact sports can be a risk. You need to take care to protect yourself and make sure you minimise risk. Make sure hair clippers and nail clippers are clean. Clean up body fluids with spill kits, not mops. So, what if the worst happens and you do get infected? Or you discover that you've been infected in the past? The good news is that treatment is available that can cure you. It can be anything from 12 to 48 weeks, depending on the person's genotype and response to treatment. There can be side effects, but one person can have different side effects to another. New therapies are coming out all the time that reduce treatment time and have higher cure rates. There you have it. You're now Hep C aware. If you think you might be infected, go and get yourself tested. It's better to be safe than sorry. It's not a dirty disease. If you're not affected, but you know someone who is, why not try and give them some support? A big part of the battle against Hep C starts by removing the stigma surrounding it, and that's something we should all be doing together. So, thanks for listening. Now, let's all try to help every person see, because together we can help to make Hep C a thing of the past.